Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this session or webinar is Advanced Concepts in Healthcare Team Coordination within the chapter that covers the foundations of excellence in healthcare administration within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Healthcare is a complex environment where patient outcomes often depend not just on the skills of individual providers or clinicians, but on the seamless coordination of an entire team. Healthcare team coordination involves the ability to bring together diverse professionals, nurses, doctors, administrative staff, specialists, technicians, and others, toward a unified goal of patient-centered care for administrative medical assistants, serving as a central node in this intricate network is both a responsibility and an opportunity. Key points. Communication as the foundation of coordination. Now, effective communication is the bedrock of teamwork in healthcare. Miscommunication or lack of clarity can lead to delays, errors, or patient harm. Communication in team settings includes verbal exchanges, written updates, and digital records. And here is a diagram showing and clarifying the enhancing communication in healthcare teams. Developing interdepartmental workflows. Each department in a healthcare facility, whether radiology, admissions, or surgery, has its own workflows. Coordinating these independent workflows ensures patient services don't overlap or contradict. And here is a diagram on coordinating healthcare workflows. Conflict resolution in healthcare teams. Tensions can arise when collaboration involves diverse roles and responsibilities. Administrative assistants often act as neutral facilitators during disputes. Leveraging technology for coordination. Modern tools such as EHRs, electronic health records, scheduling software, and teleconferencing systems enhance the coordination process. Measuring organizational efficiency. Coordination isn't just about ensuring workflow continuity, it's about maximizing outcomes with minimal resources wastage. Metrics such as average patient wait time, appointment, turnaround rates, and patient satisfaction scores help measure effective coordination. And here is a diagram on enhancing coordination for organizational efficiency. Application examples. We have coordinating multi-department appointments scenario. A cancer patient requires consultations with their oncologist, a series of lab tests, and an imaging scan all on the same day due to their tight schedule. Step-by-step process. The CMAA reviews the patient's treatment plan in the EHR to identify all required appointments. They access the scheduling software to find available slots in the oncologist's, laboratories, and radiology departments' calendars. The CMAA, which is short for Certified Medical Administrative Assistant, coordinates with department staff to align back-to-back appointments, minimizing wait times. Updated schedules are shared with all departments through the central communication system, ensuring no overlap or miscommunication. The CMAA calls the patient to confirm their itinerary and provides detailed instructions for each visit. Tools, resources needed. EHR for accessing the treatment plan, scheduling software for visibility into multiple departments, availability, internal communication platforms for confirming with the staff. The impact here, the patient experiences a seamless process, reducing stress and increasing satisfaction. Departments work collaboratively, boosting efficiency and maintaining cohesive workflows. Managing emergency cases. Scenario here, a patient is rushed into the ER with acute chest pain. The attending physician urgently requests lab work and imaging scans to confirm a diagnosis. Step-by-step process, the CMAA receives the physician's request and flags the case as a high priority within the EHR system. They use emergency communication protocols to identify the lab and radiology departments immediately. The CMAA updates the attending physician on the estimated timeframes for results from both departments. The patient is escorted through the expedited process, ensuring they reach each department without delay. Once results are available, the CMAA ensures all reports are accessible to the attending team within the EHR system. Tools and resources needed: EHR, emergency communication lines, clinical staff trained in rapid workflows. Impact: critical time saved during a life-threatening situation or situations. Efficiency in collaboration results in quicker diagnosis and treatment. Result in cross-department miscommunication. Scenario: a physician claims a test result from the lab is missing. While the lab personnel insisted they've sent it, the patient's treatment is delayed as a result. Step-by-step process: the CMAA reviews the situation by checking the HR system for timestamps of the lab report transmission. They contact the lab to cross-verify, ensuring no records were incorrectly documented. The CMAA resends the report to the physician while confirming receipt via direct communication. To prevent future mishaps or mishaps, the CMAA collaborates with IT and department leads to evaluate gaps in the notification process. Training sessions are scheduled with all staff to reinforce system usage and minimize human error. Tools/resources needed: audit logs within the EHR, direct communication between departments, staff training protocols for improved workflow understanding. The impact here restores patient care timelines by resolving delays, strengthens interdepartmental trust and process reliability. Coordinating discharge planning. Scenario: hospitalized patient requires post-discharge care that includes home oxygen equipment and follow-ups with the specialist. Step-by-step process. The CMAA works with the attending physician to identify all post-discharge needs. They contact a home medical supplier to arrange for delivery of oxygen equipment, ensuring insurance approvals are completed. The CMAA schedules follow-up appointments with the patient's pulmonologist and primary care physician. All details are documented and packaged in a discharge plan shared with the patient and their caretaker. The CMAA follows up with the patient a few days post-discharge to ensure smooth implementation of the plan. Tools/resources needed: discharge planning tools in the EHR, coordination with external vendors, detailed checklists for compelling or compiling discharge instructions. Impact: ensures patient transition comfortably from hospital to home care, reduces rehospitalization risk by providing thorough post-care plans. Facilitating inter-hospital transfer. Scenario: patient needs to be moved from a general hospital to a specialized facility for advanced treatment. Step-by-step process: the CMAA contacts the receiving hospital to confirm bed availability and coordinate staff handover. They arrange transport services, including medical staff if needed during transit. The CMAA ensures all patient records, including imaging and lab results, are securely transmitted to the new facility. Communication lines are established between the two hospitals to maintain updates about the transfer. The CMAA checks with the patient's family to ensure they understand the process, addressing any concerns. Tools/resources needed: EHR for secure record sharing, transport logistics protocols, clear inter-hospital communication channels. Impact: smooth, timely transfer enhances care continuity, reduces stress for patients and families. Streamlining pre-surgical coordination. Scenario here: a patient scheduled for surgery must first complete pre-operative tests, submit consents, and secure insurance approval. Step-by-step process. The CMAA ensures all tests, including lab work and imaging scans, are scheduled and completed in advance. The patient is informed about requirements for signing consent forms, which are collected and uploaded. The CMAA liaises with the billing department and fast-track insurance authorizations. Updates are logged in the EHR so surgical staff can verify that all prerequisites are met. Any unexpected issues, such as missing clearances, are resolved through instant communication with stakeholders. Tools/resources needed: pre-surgical navigation software, insurance authorization platforms, real-time audit tools in the EHR. Impact: avoids delays in surgery schedules, enhances patient preparation, and reduces anxiety. Handling interdisciplinary patient reviews. Scenario here: a complex patient case requires input from cardiology, endocrinology, and nephrology specialists. Step-by-step process: the CMA contacts each specialist to coordinate a meeting and confirms availability using shared calendars. Relevant patient records are compiled in the EHR and flagged for attention before the meeting. During the meeting, the CMA takes notes on the agreed upon care plan and updates the records accordingly. Follow-ups are scheduled with each specialist as part of the plan. The CMAA provides periodic updates of the primary care physician to maintain oversight. Tools/resources needed. Shared calendars and meeting tools, secure patient data sharing systems, note-taking and record-keeping protocols. Impact ensures a comprehensive approach to patient care, avoids contradictory treatment plans. Training staff on cross-department communication. Scenario here: new hires frequently misroute patient inquiries, leading to delays in resolving issues. Step-by-step process: the CMA identifies common miscommunication patterns through staff feedback and performance reviews. They develop a training curriculum, focus on department for workflows, including case studies. Interdepartmental shadowing sessions are set up to familiarize staff with rules and tasks outside their domain. Communication tools and templates are introduced to streamline information sharing. Periodic assessments ensure that staff remain consistent in their knowledge. Tools/resources needed: training presentations and case studies, shadowing schedules, easy reference guides for workflows. Impact: reduces errors and delays in patient service response, strengthens collaboration by fostering empathy and understanding. Managing delays due to equipment shortage. Scenario: an imaging machine in the radiology department malfunctions, disrupting the schedule and delaying patient scans. This creates a ripple effect impacting clinic operations and patient care. Step-by-step process. The CMAA receives notifications of the equipment malfunction from the radiology department and assesses the scope of the delay by reviewing the affected appointments. They immediately notify all physicians whose patients are impacted and inquire if alternative arrangements are possible. The CMAA contacts on-site biomedical engineers to prioritize the repair and monitors updates to determine the equipment's availability. If the delay is prolonged, they reach out to backup imaging centers. All impacted patients are contacted promptly by the CMAA to explain the situation, offers alternative solutions, and provides rescheduling options. Tools, resources needed: scheduling software for rescheduling or coordinating external appointments, a contact list of network facilities to arrange alternative imaging services, communication platforms to inform staff and patients about delays. Impact: patient anxiety is alleviated with transparent communication and quick solutions, avoids further operational disruptions by coordinating alternative resources, maintains the healthcare facility's reputation by prioritizing patient care during unforeseen circumstances. Organizing vaccination events. Scenario: a clinic plans a community-wide flu vaccination event targeting hundreds of patients over a single day, requiring careful coordination across departments such as pharmacy, nursing, and scheduling. Step-by-step process, the CMAA works with the pharmacy team to ensure adequate vaccine supplies are delivered. They coordinate with the nursing department to assign a sufficient number of staff members. Appointment slots are pre-scheduled using the EHR, and the notification system is used. The CMAA sets up a patient registration station and ensures consent forms are prepared and properly stored post-event. Following the event, the CMAA compiles data on doses administered and generates reports for internal review and submission to health authorities. Tools/resources needed: vaccination scheduling models within the EHR, inventory tools for monitoring vaccine supply, a checklist for event organization, including staffing, patient flow, and documentation. Impact: facilitates a high volume of vaccination event efficiently, improving community immunization rates, enhances patient satisfaction, demonstrates the facility's ability to execute larger scale public health initiatives, reinforcing its value within the community. Summary tables. Here we have a table on key communication strategies and healthcare team coordination, table on interdepartmental workflow coordination, table on conflict resolution in healthcare teams, table on leveraging technology and coordination, table on application scenarios in real-world settings. Next, we have We will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary benefit of using centralized scheduling software in coordinating multi-department healthcare workflows? A. Avoiding the need for direct communication with departments. B. Ensuring patient satisfaction by reducing wait times and scheduling conflicts. C. Allowing patients to book their own appointments directly. Or D. Preventing changes to pre-assigned schedules. Definitely the most accurate or proper answer would be B. Question 2. Which of the following best describes the role of closed-loop communication in healthcare team environments? A. It speeds up communication by skipping confirmation steps. B. It ensures the sender's message has been understood and acted upon. C. It focuses exclusively on written communication for accuracy. Or D. It prevents changes to patient records after the message is sent. Definitely here, the most proper answer is B. Question 3. How can training programs improve cross-department communication in a healthcare setting? A. By creating permanent scripts for every possible miscommunication. B. By limiting interdepartmental contact to essential staff only. C. By offering shadowing sessions and workflow overview trainings. Or D. By focusing only on communication tools without addressing workflows. The answer here would be C. Question 4. What is a key advantage of using EHR systems for resolving interdepartmental conflicts related to missing patient test results? A. EHR removes the need for staff communication entirely. B. EHR provides audible alerts for urgent conflicts needing resolution. C. EHR logs offer timestamps and records that verify task completion. Or D. EHR allows direct modification of testing protocols without consultation. And the answer would be C. Question 5. During a community-wide vaccination event, what role does the CMAA play in ensuring smooth operations? A. Administers vaccines to patients personally. B. Oversees inventory levels and assists in patient registration. C. Manages aftercare appointments but is uninvolved in day of operations. Or D. Only prepares consent forms and has no further responsibilities. And the answer, definitely the most proper answer, would be B. Oversees inventory levels and assists in patient registration. And here we come to end of this lecture. Thank you very much and goodbye.